I got an interesting question yesterday, and I thought it would be a great opportunity to make a video on it because it affects so many people in the United States, around the world, and that is, if you have back pain, what are 3 simple things that you can do to try to self-manage that? Regardless if you play golf, if you are just trying to pick up your grandkids because you're babysitting them this weekend, whatever the demand is, the 3 common areas that will tend to lead to the insidious kind of back pain where you just move funny and all of a sudden the back kicks in and it's bugging you, or you wake up in the morning and your back hurts. There's 3 common areas that you can really look at going after that will a lot of times definitely lessen the back pain and sometimes totally get rid of it, so you don't even need to seek out medical attention. If you try these 3 and it is still bugging you, I would recommend that you do go see a local, whether it's a physio, a chiro, some healthcare professional. Generally, physios or chiros are going to be more able to help you manage it and fix it quicker, as opposed to going to your doctor, who then is going to give you a referral to go there. Usually you always want to try to go after the soft tissue first, particularly if there wasn't an acute fall or you're worried about anything being broken. So the first area, or the 3 main areas we're going to look at addressing are going to be your psoas, your glute, and your thoracic spine. So we think about if your low back is hurting, we generally want to treat above and below, and the psoas is a very centrally located muscle that actually attaches into the front of your lumbar spine and can wreak havoc in terms of really getting tight and spasmed out and causing a lot of issues. So I have here your 2 tools that you would need. One would be a softball, or a ball somewhat of this size. The other is what I'm sitting on, that's a foam roll. You could get more aggressive and go with 2 lacrosse balls, or 2 balls kind of taped together on your spine. For the sake of this video, we're just going to use a foam roller. So we'll start at the top, we'll work our way down. The first area you're going to want to look at addressing is releasing any tension or helping to get into extension in your thoracic spine. So what I'll do is move sideways here. So basically you're going to take the foam roll, put it kind of right at the bottom of your ribs, arms crossed, pick your butt up off the ground, and then you can just kind of roll back and forth. You might get a couple cracks. You can go arms up overhead. You can kind of move that around however, whatever feels comfortable, whatever really helps to open it up. You can do, like I said, the 2 lacrosse balls along your spine, up and down. If you find a spot that's really uncomfortable or really sticky, you can come here and try to kind of fall back over it. So you can kind of work joint by joint, going up each and individual vertebrae. The second one that you'll want to look at getting after, and this is usually, particularly if it's soft tissue oriented, a very common radiator of pain up into the low back are going to be your gluteus medius, which is kind of on the side of your hip. So you're going to sit down on the ball. Usually you come down onto your forearm, and then you're going to kind of roll the ball. You can see it's actually very much to the side of my hip, and I'm going to go pretty high. My hip comes all the way up to here, so I'm going to work. It's usually a lot higher and more to the side than people think when they're thinking about their butt. Once I find a spot, I can either go cross friction back and forth on it, or I can hold it there, try to breathe it out. Generally 30 seconds or so, it should start to ease up. Or if it's really stick and being stubborn and not letting go, I can then go and kind of attack and strip, where I'm moving my leg and my hip while I'm keeping the ball on that tight fascial point. If you find a spot when you hit it in your butt and it reproduces or increases the pain in your back, that's probably your active trigger point, and so that's a good sign. Try to really stay on that and try to work that out, see if you can get that to relax and ease up. You'll actually probably feel a heck of a lot better when you get up off the ball. The final area that you're going to want to look at addressing is going to be your psoas. So if you're looking from your hip bone kind of up to your ribs, if this is your belly button, come generally 2 to 3 inches to the side. I'm going to try to angle this in on about a 30 to 45 degree angle. So I'm getting down onto the ground in that spot. I'm going to angle myself just slightly up towards the camera here. I'm going to find a spot that's kind of a little bit uncomfortable. The psoas comes up right along the side of the spine, or kind of into the spine. So think of kind of pushing towards the midsection. If you find a spot, then you just kind of hang there, just breathe, and just try to let yourself sink into it as best as you can. And you want to work The psoas is a very long muscle. It comes up from the inside of your hip all the way up into the upper part of the lumbar spine. So you do want to kind of work it up and down that entire length. So those are three simple areas, three simple things that you can do if your back is bugging you and you need to be active for some reason. Like I said, it could be going to babysit the grandkids. It could be trying to get out and play around the golf. It could be trying to get out, with the guys and play basketball, whatever it may be. If you're trying to be an active individual and you're struggling with some back pain that kind of came on just randomly, those are three simple areas that you can address that oftentimes will allow you to basically self-manage. If it does not get it all the way better, even if it does, it's probably not a bad idea to seek out a local healthcare professional, typically a physical therapist or a physio or a chiro, somebody who's really, really good at understanding soft tissue and body relationships, muscle referral patterns, all the biomechanical stuff. That's typically going to be your fastest way to getting better and making sure you actually address the cause and not just the symptom. You certainly can go to your doctor if you're worried about anything else that's a little bit more, a fracture or something along those lines, but typically your physio, your PT are where you're going to end up, so you might as well just start there. So hopefully this helps you, and I look forward to hearing how you're going to be playing better, feeling better, and obviously having a lot less pain.